What's up, guys? Dr. Chris Park here. Look, when I was in training, when I was in residency, one of my attending physicians, he was telling me about this medicine that he was using to help people who were struggling with addiction. He was talking about Suboxone. It was fairly new, and I don't know how long it had been in use at this point, but I will tell you this, that this was the largest, where I trained was the largest rural hospital system in the United States, and it was maybe him and one other person. He was basically the only person doing this at the hospital. And so I was very interested in learning how to treat addiction. I did a lot of extra, work at the psychiatric hospital, helping to run like the detox ward and treat patients coming in and kind of starting their recovery process. And it was kind of, being able to use something at an outpatient basis to help control withdrawal and cravings. This was, very exciting and new. And one of the things that we would discuss is, what's the best way to dose the medicine? And I've talked about before that, initially a lot of times Suboxone was used just like kind of as a quick taper, so that people could get out of withdrawal, but then get off of everything. But so many people were relapsing that it seemed like a longer treatment course was more appropriate for most people. And it seems like that's what most people do now, that they just kind of tend to stay on medicine for a very long period of time while they get their life in order. And I've talked about that a lot on other videos. I'm not going to hit that over the head anymore, but I think that's very appropriate. But the other thought is, well, not only how long should somebody stay on, but how do you split up the dose? Because Suboxone is very long acting, so you could dose once a day and you could figure out how much the person needed, whether that was 8 milligrams, 16 milligrams, 24 milligrams, and you could dose once a day and they would be fine. And in some ways, you think about it psychologically, maybe this is good because you get people who are taking a lot of pills and now they're not taking it and they're just like getting a dose of something once a day. Similar to how you might think of a methadone clinic dosing people. But I tended to like to spread out the dose. One of the reasons I found was a lot of folks were just getting like too drowsy drugged feeling when they took a large amount at once. But if they took a small amount, they would almost always feel like they needed to redose later in the day. So with my practice, I tended to spread out the doses more often, especially if people were needing a larger dose. Now, I'm not going to get into on this video who needs a higher dose of Suboxone, who needs a lower, because I know there's lots of opinions on that, and I've got my own, methods of this. But let's say, so the whole point of this video is I want to talk about how do you taper if you're on a split dose. Like let's say you're taking an odd split dose. And I basically had this question the other day, so that's why I'm going to take this topic. Let's say you've tapered down, you were on a high dose of 24 milligrams a day, you tapered yourself, you got down to 10 milligrams a day, but you're taking like 8 milligrams in the morning and 2 in the afternoon. And I think that, and I've talked a little bit about this, but I would definitely, the plan is not to then try to even these out. You don't have to have them evened dosing. We would just slowly taper off the lowest dose. That's almost always what I would do. There might be instances where somebody, we might, change that and start to taper off the morning based on, whatever reason they're starting to have withdrawal. And some of that could also be because when you start getting into such small doses, like if you're taking an 8 milligram tablet, which is, one of the worst things to try to cut up, right? You don't know if you're getting a full dose with your little sliver. And so sometimes that can be difficult for people. So they get to a very, they're taking like one tablet in the morning, and then in the evening, they split it up to a very small amount. They take it, they can't even tell they took anything, and this could be problematic with tapering. So in that instance, I might, take a little bit off the higher dose in the morning instead. But in almost all cases, I'm going to taper that smaller dose in the evening until I can get them to once a day dosing. Now, we wouldn't just stop that. we would make extremely small dose reductions over time. And I've talked about this before. I like an alternating dose method so that maybe you took 1 milligram today and tomorrow you go back to 2 milligrams and then 1 and 2 and 1 and 2 until you felt kind of comfortable with that. And then we would go down to 1 and then we, keep working from there. In some instances, some people can just make a quick, jump and stop and just see how they do, or maybe even stop and then every third day take a 1 milligram. There's little ways that it can be adjusted based on the patient's need. The problem I see most often is people make a large jump because they get a lot of momentum. They're excited about tapering. They want to make some progress. They make a large jump, and then 3 or 4 days later, it hits them. And then they go back to their old dosing, and they feel like, they're never going to get off it at that point because it's like they've hit this psychological wall. But instead of that, we go slow and low, and we just slowly taper that, and it seems to be better. Or if they want to go a few days, feel whatever happens, then you could take a small increase, again, using like an every other day model, just like a small dose to break if you're having some kind of withdrawal, and then go back off of it. Let me give you an example. Let's say you're doing an 8 milligram in the morning and a 2 milligram in the afternoon, and you just were gung-ho, and you're like, I'm going to stop this 2 milligrams in the afternoon. And so you're doing well for 3 days, and then all of a sudden it hits you. Maybe you're just extremely lethargic. Maybe you're having restless legs. Maybe you feel sweaty in the afternoons now. Maybe you just had this kind of psychological itch. Well, in that case, you could probably just dose a 2 milligram and then go back to the 8, and then 2 days later, dose another 2 in the afternoon. And then in between, take the 8s. You would probably find with that and then start spreading that out. Again, I would prefer a slower method with an alternating dose approach, but I think that's also a reasonable, option for people who are just gung-ho and want to see what happens if they drop a large amount. Because in a lot of cases, people drop, when I say a large amount, like going from 10 milligrams to 8 milligrams, when they make that drop, they feel okay. You know what I mean? And they can kind of, but you want to make sure you're stable before you then make another drop. And so I usually like to, if we make a large dose reduction, I just kind of have them hold out there for a month or so. And it's kind of interesting because, I had a patient the other day that like last month he was having a lot of problems and we had to up his dose, just a very small amount. But he was just talking about how his long-term goal was to stop meds. And I was like, okay, so what are you thinking? Like what? And he's like, man, maybe in 3 or 4 months I taper off. And I'm like, well, I mean, let's say in 3 months we get back to where you were at that lower dose. Because it just seems like you're going to have a goal that you can reach that's not unreasonable so that you can build the momentum, I think. And so if you're wanting to taper off meds eventually, you need to set a goal that you can hit, okay? Hit that goal and be happy you're there and just, be stable for a little while. And then you can reevaluate and change your goals and make it to, okay, now my goal is I'm going to get here. I almost always look at tapering like lifting weights or working out. You set up a plan and you've got to make these improvements. You've got to have a small cycle to get to where you want to be. Like if you want to lift a certain amount in 3 years, well, the first thing we got to do is figure out, okay, what's an appropriate program just to increase, your strength in the next month. Does that make sense? Or a running program. I talk about running programs a lot. Like if you're going to run a marathon, we're not going to go run it tomorrow. First we're going to see, okay, if we're not running at all, we're going to just set up a low amount of running volume this week. We're going to recover from it. And then maybe in two weeks, we'll increase a little bit. We're just going to we're going to get better at the small things first. And eventually all that improvement is going to get you where you want to go. But we make the small changes and we make them and we are successful with them. and then we build off those in the long run. So, all right, that was kind of a long video just talking about tapering split doses. Hope it was helpful, guys. Leave a comment if you have any questions, concerns. As always, talk to your doctor. Don't take advice off the internet. Your doctor can and will help you. You just need to talk to them and get a plan together. Peace.